Well, welcome to this amazing panel. I'm really excited for this. I've been looking forward to this for a very long time. So I will do brief introductions and then we'll get started. So on my far left is Craig Kennedy, who is the CEO and president of MHPA. RJ Briscione, depending on if you're Italian or not, who's a principal at the focus group. And my wonderful guest, Jane Dixon, who is a member at the Vail place. And then Julie Plante, what's your new title? Your
Director of Integrated Care.
Okay. Really want to understand the personal connection that all of you have with social determinants of health. Can you tell us a little bit about how you got involved and what makes you so passionate about this space and, especially trying to break down some of the barriers and deal with some of the friction with social determinants of health? And so we'll just...
All the way down
you
here?
can go
okay,
first,
right.
yes.
I only have a 20-minute intro, so I'll try to make it quick. So now, see, the lunch crowd is really like, oh. My name is Craig Kennedy, and at Medicaid Health Plans of America, that's a primary focus, right? Social determinants of health within the Medicaid space is a huge driver of what we try to accomplish every day. And so, the coverage of the millions of covered lives of our members and all those things are the day-to-day business, right? But what your question was really about the personal history and how we got to this point. Mm-hmm. I've been at MHPA for 2.5 years, a little over 2.5 years. Worked at Clinicians for the Underserved before that, and then the National Association of Community Health Centers before that. So been in healthcare associations for 24 years, and then worked in Capitol Hill before that. But so healthcare policy for quite some time. But before that, I grew up in Oregon, even though everybody says, oh, where do you live? I live just outside of Washington, D.C. I've lived there longer than I lived in Oregon, but I still tell people I'm from Oregon. Because that's just the way it goes. But I grew up in a very small town in Oregon that had a little bit less than 2,000 people. And we grew up in the sticks outside of Rainier. And it was a single wide trailer. And we were on the free lunch program. Occasionally when my parents both worked, we would make it to the reduced price lunch program. But we had real challenges all the way growing up through life that we always speak about. It's the social determinants of health, like it's a buzzword of something, but it's people's everyday lives that we're talking about, and we really got to get to the humanization of that, because for me it's about what my family went through every day, facing challenges the way we grew up. So,
thanks. How do I follow that? Hey, I'm RJ Briscione, so I am my title now is principal at the Focus Group, which is a boutique healthcare consulting firm. But until about a month ago, I led social determinants for CVS and Aetna. And the way I got to that, I could do a 20-minute intro on the way I got to that. But the way I got to that is I worked in Medicaid operations for 10 or 12 years before I decided to really take that on. And what that meant was being literally on the ground with people. And there were two transformative experiences that made me realize that we've got to do way better on it. One was volunteering at an opportunity called Remote Area Medical, which Remote Area Medical does these really all over the country. Actually, they started out doing it all over the world and realized they had to do it in America, which says something about our healthcare system, obviously. And it is providing free healthcare for basically anybody who needs it and who will come to it. We talked a little bit, and I think we'll get into this a little bit in the panel, about access and cost and convenience, right? So people come from hundreds of miles around to line up to get healthcare, to see a doctor for the one time a year they're going to see it. This is in Southwest Virginia. Many of them came straight out of the mines. They were in their coal mining clothes, right? We've had a big discussion on coal mining in this country in the last couple of years since. So they're coming just to get the health care, just to get seen. Most of them have no teeth or losing all their teeth. Some of them are coming just to get their teeth pulled. That was one thing that said, we've really got to do better. Another one I'll skip over because I'm probably over my intro time, but I'll circle back to it in a little bit. But that led me to, after years of working on Medicaid bids, on saying, for 3 different large healthcare companies, saying, hey, state, we want to serve Medicaid members in your states. I said, we are not going about this the right way. And so I had the honor and the challenge to found internally at Aetna the first social determinants kind of enterprise group to be able to try to tackle that.
Julie, I'm going to go to you next.
Okay. So I'm Julie Plante, and I'm working at Vail Place right now, which is a community mental health agency, but I've worked in mental health and working with the disabled population in the metro area for over 25 years. I also have lived experience, and through my career time, having worked in both social services and community health care, I've worn a lot of different hats, and I have been frustrated with seeing a tremendous amount of waste and unnecessary barriers stacking up for people every day. And so, I mean, that's kind of where my whole career's been driven. And right now I'm helping to drive initiatives in our community mental health agency to expand integrated care health access to most of our population, which mostly are people on Medicaid. But we're looking at creative and different ways of doing it. So it's kind of like, it's where I begin, and hopefully where I'm going to end is trying to make things better for the next go-around.
Thank you for the work you do.
Thank you.
So Jane, I want to understand a little bit about how did you learn about Vail Place? And can you tell me a little bit about how it's helped you?
I learned about Vail Place long before I even joined, through a doctor told me about it. And I joined 13 years ago. And it helps me with community support, employment, and socialization and stuff like that.
Mm-hmm. And I think you told us a story about how they helped you with smoking cessation.
Yeah, I was a 40-year smoker, a pack a day, and I had, under Vail Care, there's a person working with me on smoking cessation, and I've gone about 3.5 months without smoking now. And she helps me with, I smoke a lot when I'm maybe stressed or something, and she's helped me with stress management.
That's wonderful. I think that's how the healthcare system should actually work, where your doctor gives you a referral, and it's a testament to also you being able to quit and the power that takes. Mm-hmm. So let's turn to just some of the work and the initiatives that are happening with social determinants of health. I'm gonna, Craig and RJ, don't act surprised. What improvements have you guys seen? I know every day seems like there's a little more change, things are getting a little bit better, but what do you guys see on a daily basis that's improving?
So I was actually somewhat surprised that what I'm going to talk about is in the book that you handed out to folks today, which is super cool.
Yeah.
So, and that is our work when I was at Aetna and CVS with Feeding South Florida, right? And it sounds like a pretty simple concept. Give people food and they'll be healthier, right? There are about 1 million things that can go wrong with that, and 1 million pieces of red tape that get in the way of doing that if you're going to do it for a Medicaid, Medicare population. And exactly how you pull that off, how you get the folks food, how you measure what they're doing. So over the years, it's this kind of longer partnership with Feeding South Florida we've been able to establish and learn from. So the very first iteration was, we're going to go feed this elementary school. We're going to take on this one elementary school and feed, and especially make sure that we feed the families. We'd seen some research and learn from our partners at Feeding South Florida. I think that's an important takeaway there, is like, those people know way more about it than us knuckleheads sitting in Hartford, Connecticut or Rhode Island, in a bunch of offices are ever gonna know about it, right? So we learned from them, like the backpack programs, the kids just take the backpacks and that food's gone in a day or two, right? and we really wanted it to be healthy food. So we worked on what that distribution looks like. And then we had great results from that, some really amazing, especially some stories in our focus groups of families who said their kids were pre-diabetic when they started it, and they're not anymore. But some of you have heard me talk about this before. When I was down there at one of the distributions, or many of the distributions actually, where I'm watching people walk out, and this is where my other big lesson is, if you solve one social determinant, you solve one social determinant, right? And so you have to go in with a multi-pronged approach. I'm watching the people walk out, and the people are either the moms or the grandmoms. It's all multi-generations living together in the neighborhood, and they're all walking, because if somebody in that family is working, it's the dad or the grandpa, and they're sharing the one car that they have, if they have a car, right? And so we're watching these moms and grandmas, South Florida heat, it's always hot, it's always humid. We're giving away great stuff. We're giving away large melons and really cool stuff that comes right out of the ground there in South Florida. But we're failing them because they're dropping stuff literally on the ground as they're walking away. So we came up with another solution for the next iteration of it, and that is this mini mobile pharmacy where it's much smaller, and it goes to a lot more places. And we partner with healthcare clinics now to be able to deliver that in a much more efficient, neighborhood-centric way. The transportation is either taken care of by us or by the clinic itself. And what we wanted to do was really get some tight measurements around it. So how are we finding a social determinant to measure and finding a healthcare to measure? So we had the clinics identify members that were both food insecure and had higher uncontrolled A1Cs, right? And so the question is on what changes are you seeing? Those A1C measurements dropped so fast and so far that my boss, who was a doctor, thought we were making it up or we were fudging the numbers or something. So, but it's really cool after 3 years of really hard work, separated by the pandemic where we couldn't really do that in-person stuff, to see those changes happening. And it's the thrill of a career so far to see that.
I'd piggyback on that, using the term multi-pronged approach. I think that's what's exciting to me, is that social determinants of health, everybody sits there and says, oh, housing, transportation, food, got it. Yep, that's true. Those are true. But a true multi-pronged approach takes all the other things that are happening in their lives and says, those are real things and real challenges. And I'm starting to see a lot more plans address social determinants in a multi-prong approach. I was literally with one of our plans in Virginia talking about banking and fair banking policies. I was with a colleague who runs the Medical Legal Partnership about legal challenges that people face. And she had told me of the clients she sees, they have between 4 and 5 unresolved legal issues facing them. And if you just think about that for a minute, you have 4 or 5 legal issues facing you right now. And for some of us, those might be smaller. I got a traffic ticket, got it. But it could be bankruptcy, divorce, right? You're being sued, you have child support, you have a whole bunch of things, unresolved legal issues that take your mind to that too, to this. And that we're addressing social determinants not as these 3 things. Social determinants are these 3 things, that's it. That it's a multi-pronged approach, and that we're sitting there and seeing people as people and saying, what is the challenge that's facing their life that we can help address? On the banking, some crazy statistics. I think one of the previous panels mentioned about bouncing a check. You know who bounces checks? People on Medicaid, right? Yeah. Let's just be honest. That's our folks do it, and they get charged for it. Yeah. And they get charged for it. It's great to hear that there's a bank that is not charging for that. And if you have a certain balance, of course, you don't get charged for it either. But that's not the folks that we see every day. That's not the way I grew up. Yeah. You got charged for that bounce check. And today it's probably $35. And you, on average, bounce about, our populations, not our populations, the ones that I was working with in a certain state, bounce about 7 checks a year. Mm-hmm. Do the math. And you've all heard the statistics about people in America don't have $500. They can't absorb a surprise $500 charge. but they're already paying that in bounce check charges, right? You're already facing that challenge. You already are eating $500 in challenges, except it's in your bank. That's also a social determinant. These are things that are making your life challenging all the way around. It's not just the standard social determinants of health that we've always heard of, and I love people who work on that. Those are huge issues. But so, as RJ pointed out, it's a multi-pronged approach that we're seeing more and more of, and that's really exciting to see.
That's great. I think something that's near and dear to so many of us is the mental health challenges that overlay social determinants of health and what a contributing factor that brings and a layer of burden that you just can't get out of at times. Jane, you guys are doing so much in this, Julie, and I'll ask Jane. Julie, you guys are doing a ton in this space. Can you, if I'm in the audience, I have family members, I have members, people all over the United States, how would somebody go about finding an amazing resource like Vail Place?
Well, for starters, Vail Place is more than one thing.
Yeah.
So we have our clubhouses. Jane is a member of our Vail Place Clubhouse. She's also enrolled in one of a program that I built, which is a behavioral health home program. That's our Vail Care program. So she's enrolled in multiple things. In terms of access to a clubhouse, the clubhouse model is an internationally accredited model. And if you look international clubhouse, go online and to Google that, you should be able to find it. They're all over the world. And a clubhouse space is unique because it's not just a community drop-in center. Clubhouse space is designed to provide everything that all the panelists have talked about today. All of the nutrition that you need that comes from socialization, meaningful activity, learning new skills, having a place to belong, all of these things, and including in practical things like financial management, just everything that everyone's talked about. It's all under one roof. And the only criteria to belong is if you have a mental health diagnosis, you're automatically eligible because we know you already automatically have an extra burden or something that you carry in life that sets you at predisposes you to have poor health outcomes. And because of the stress and because things don't happen in isolation, everything is connected to everything else. And so if you have one issue, you're likely to have many issues. And your primary issue is probably compounded by the 5 or 6 other things going on. And so we see how these things catapult people to a loss of life expectancy. And also, if you're a health insurance plan, they're sometimes very costly because they're getting a lot of things treated sometimes in the emergency rooms or things of that nature because things escalate. And so, we have that clubhouse, and you can, by looking for international clubhouse, I don't know if it's .com or what have you, you should be able to find where clubhouses might be in your neck of the woods. In terms of other programming, I can tell you that the behavioral health home model right now is a state Medicaid program. There's a number of providers doing it in the state of Minnesota. I don't actually know if it's happening anywhere else. I'm too busy right here. But I can say that I think ours is pretty robust and unique, and a lot of what we're piloting in my behavioral health home are things that we're now taking to payers and starting like direct lines of service with places like Health Partners, Blue Cross Blue Shield, to show that all of these things wrap into healthcare. And so like when Jane talks about getting support with smoking cessation, employment support, housing support, she can get all of that stuff through one value-based payment model through a program like ours.
That's amazing. I love the fact that it's, there's so many options, but I feel like one of the things that is very difficult is for people to understand how to access it, and that's an available resource for many people. So a lot of people in the audience are working on building these programs and designing them. What is important for people to keep in mind as we're trying to design programs like Vail Place? to help support these communities. And maybe, Jane, can I turn to you and maybe you can talk a little bit about some of the social support, employment support that you've received from Vail Place?
Yeah, they have what you call the work order day, which is kind of explains that it's not like a drop-in center. Members run the clubhouse, and that's from cleaning bathrooms to doing data entry and cooking, nutritious meals, and eating lunch there. Social activities, like I do walking, I've done yoga there, and my favorite is hiking, and which gives me exercise, and it just has me connect with other members with dealing with the same stuff that I deal with. And I think it's a real good thing. It's kept me out of the hospital for about 6 years now, and because I had a history of going in and out, which is costly compared to just being at Vail.
That's wonderful. That's the way this should work. And I applaud, Julie, what you guys are doing to help make this a lot better. Craig, can you talk about some of the important things to keep in mind when building these programs?
I do. I'm still stunned by the comments. Staying out of the hospital is financially important, but it's important to your life, right? It's about the people we serve and their life. And we sit here and we talk about money a lot. And I get that. But it's people's lives, right? Staying out of the hospital for 6 years. Did you say 6 years? How long?
Yeah.
Yeah. That's remarkable. That's
amazing.
Fantastic. I'm giving her.
Yeah, really.
That's sort of a life-changing outcome is because somebody saw her as a person instead of a number and went through it. And what frustrates me a lot is we talk about either finances or we talk about millions and millions of people. And I get that. There are millions and millions of people on Medicaid, in difficult situations across the country. But what we really need to understand is they all have a name. One of them is sitting right here. Well, we're all sitting right here. We all have different backgrounds and how we come about this. But they're individuals. They're folks that we live and work and talk to, and they're parts of our family. It's not a nameless, faceless number somewhere. It's people. And I think we start to lose some of that when we start getting further and further away. I work in Washington, D.C. We have an expert way to do that. We work in Washington, D.C. We make it nameless and faceless and about numbers. And you really need to keep that personal view of it. You need to know that it's our families, right? It's the families that we're working with. It's my brother, right? My brother is, strangely enough, I took this job and then found out my brother is actually enrolled in Medicaid. I thought he was uninsured. I was really panicked that he had been uninsured, and come to find out he's on Medicaid. Maybe somebody put me in this for a reason. But all of these social determinants that we talk about are challenges for people, and they all have names. My brother's name is Charlie, in case you're working on it in the future. You can say, I'm helping Charlie, I'm helping Jane, I'm helping Julie, I'm helping folks specifically on how to address these things instead of this nameless, faceless social determinants of health and numbers in millions. We really need to think of it in personal terms and those challenges that the people face instead of statistics, in my view.
I think that's so important. I think until you actually live it and experience it. I have a stepdaughter who's homeless and on Medicaid. And until you go through that, you don't actually understand all of the different barriers that exist. And you realize as a healthcare professional how hard it is to even help when you're an expert in the industry. But we can go down the rat hole of how difficult it is. There's a lot of amazing things happening, and I think Jane here is a testament to that. What are some bright spots that you're seeing, RJ?
Yeah. So I'm going to jump on the end of that question and flip it into bright spots also, because the big bright spot is, you alluded to this earlier, is like, we're kind of figuring it out, right? Like, some of the bright spots, I know this is a flip, but is like what we've learned frankly, from failures, right? So we did exactly what Craig said. We said, oh, we're gonna roll out this big, giant social determinants thing, right? But it does not meet the Medicaid member where they are. But to our credit, in my situation, we were able to do a lot of learning with the members and understand where they expect that to be. And some of that was because some of these things are so new, they're not expecting to see it from their Medicaid health plan, right? And so we had the discussion earlier, the earlier panel on meeting the customer or knowing the customer, right? And so like knowing that specific member and what their needs are and where they are, we're getting a lot better at that to be able to serve them social determinants from the lens of a Medicaid insurer, and with a lot of partners on the ground. So I think that's a huge bright spot. One of the other things I'm seeing is like, we talked about trying to tackle multiple at the same time, and there's been a lot of discussion about housing here. Housing is really, really, really crazy expensive. We at CVS threw hundreds of millions of dollars literally at housing a year and made, much less than a 1% dent, I'm sure. I don't know that number off the top of my head, in the number of unhoused people in America, right? So I'm seeing a really cool bright spot is that there are now, I spent a lot of time talking with and working with early stage companies because I think the innovation is going to come from there. There's a lot of investable, market-based, if you will, solutions for housing for Medicaid members, for goodness sakes, that are going to be coming to market in the next couple of years that can stand alone, where we don't have to just throw, CVS's corporate dollars hoping to get a little bit of return from a real estate investment into that, and really see some on-the-ground solutions that I think are super exciting. So that's another really, really bright spot for me. And then, I'd be repeating earlier, but to have at least figured a little something out and have real results from that, from giving people food and showing my doctor bosses what's the ROI, right? Like everybody's favorite question in social determinants. There you go. Your A1Cs are down. Like, how many things can you calculate an ROI on off of that? So there's a couple for you.
Julie, what about you?
We're talking bright spots?
Bright spots.
Well, bright spots is, for starters, I'm grateful that the payers or health insurance companies are starting to pay attention to the work that's been community workers have been doing for decades already, because we need your help. We need your help. And we need you to take notice, and we need you to not try and reinvent things that are already happening, but instead invest in your own local communities, in those spaces that are tried and tested and true. Like Vail Place has been here for 40 years, and we're not the only one providing great quality service here. But to bring people to the table around those conversations and look for those opportunities to partner. At Vail Place, we've had an amazing partnership with the North Memorial Healthcare System. And now we're partnering specifically with, like I said, Blue Cross Blue Shield and Health Partners. But what I'd also really like to see, my hope is that we can expand these types of smarter experiences and cost-saving things to people not just on Medicaid, because guess what? Yeah. Social determinants of health, high-stress things, family catastrophes, those things happen to everybody. I have 3 family members who work full-time, who can't access basic things they need and are confused and confounded by the system all the time. Yeah. And as a healthcare professional myself, they come to me to ask them for help, and I'm with them, beating my heads against walls, and we're wasting money and wasting, So those experiences need to be improved across the board, right? Because the waste isn't just in one spot, or misuse or poor use isn't just in one spot. And so I think, tying onto that, I see the hope is that the potential for continued growth and expansion and recognizing different types of healthcare workers. Like, we're employing community health workers. We've been partnering with community paramedics, understanding the role of social workers, doing boots on the ground stuff, public health nursing, all of those types of things that are already getting in the nooks and crannies everywhere. They are doing the work that is helping to build better health in the communities all the time. So how can we help keep these places alive? how can we help them stay sustainable? That is a bigger challenge right now. I think when the resources are shrinking, the need is increasing. That's all we hear about is the need is increasing, but the resources are shrinking. So how can some of the bigger entities become part and we can all get stronger? That's where I'm hoping.
So Jane, I'm gonna let you have the last word. So what is one of the best things that Vail Place has done for you, and what is a bright spot that it has brought?
Well, it's bright spot. It's brought my mental health to, I don't know sure how to put it, doing really well compared to what I was, and connecting with people, and I really enjoy the activities.
Thank you for sharing what you're doing and your story and all the successes. That's wonderful. So I guess we will open it up for questions at this point. I think if you have a question, raise your hand.
Hello. I have a bit of a two-parter based on kind of the looming situation. I'm curious what the panel thinks about which social determinants of health, or how they'll impact those who need to go through redetermination. And also, what should both plans and states be thinking about as the end of the public health emergency approaches?
You.
I have a 45-minute presentation on it.
Yeah.
Come see me. Yeah, no, we'll talk. This is a huge issue. I would say, first and foremost, housing. If you're looking at it from a social determinant lens, how do you connect with the folks that have to go through the redetermination process? They have moved. And especially people with housing insecurity, or are homeless, or are foster children, or a whole bunch of Medicaid populations that you need to connect with to go through redetermination. Housing, any sort of housing challenge gets you out of that system because the address has changed. And I can't even connect with you to get you into redetermination. So I would put housing way up that list just because we are having such a challenge on addresses with the states, because the states are mailing out things. They're mailing out stuff to the last known address, which makes sense, except it's 2022 and you've moved. And there's other ways to do it. You guys all know that. So your question, social determinant, for me, housing instability is the most important in the redetermination phase, but I have there's more to that. Sorry.
Yeah.
Yes, sorry.
Hard for me to improve on that, to be honest. I'm not a redetermination expert, but I will say, we've done those same challenges before, right?
Yeah.
Like, so unfortunately, it is 2022. I had that exact same, I was talking to folks about this last night, issue when in Virginia, we started the first MMP, the first duals demo, and we basically flipped the switch overnight, and we had to do the same thing. None of those people were where the state had the last address for them, right? So, like, you would think 8 years later we have better technology, right? But, that was a boots on the ground exercise there. Like, quite literally, I turned out everybody I could possibly find to knock on doors.
But that goes back to Julie's point of local folks being engaged in everything.
100%, yeah.
Right? She knows how to get a hold of people.
Exactly, yeah.
So,
Yeah, we spoke about that in our Medicaid Advisory Council yesterday, boots on the ground.
Yep.
One of the most important things. Julie, how are you guys addressing the redetermination or re-enrollment, issue once the public health emergency expires? Yeah, loaded question.
I mean, it's tough. You're talking about an age of more choices for people that, again, things are overly complicated. We don't understand it. It's just one more bunch of, typically anybody who's, on that probably has more paperwork with other things to do. These paperwork things and all of this shopping and stuff, it's not necessarily a great benefit. Sometimes it's very, very stressful for people. I think access to having that sense of an advocate to help you understand so you know what you're doing. I mean, I think those are some of the big ones that come up is how much help is there to help the average person jump through the hoops that they're being asked to jump through.
Yeah.
And may never have jumped through before.
Right.
If they enrolled in the last 2.5 years, they've never done it.
Yeah.
It's a brand new hoop. So,
Yeah, it's crazy. As we've been doing work in the space, tried to submit an application just to go through the process. It was 18 pages. I mean, I was just done after 7, and we work in this space. It's crazy to think that that's what we're asking. Any other questions from the audience?
right there. There's one right.
Yeah, they're going to get them a microphone.
Besides improved mailing addresses, what additional data would be beneficial in improving outcomes?
To improving outcomes within the redetermination or healthcare outcomes?
In
How big
healthcare,
are you?
with
How
social
big is your
determinants of
question
health,
here?
yeah.
So,
Yeah. What other data elements would be helpful to improving?
Well, I think the last panel, the preferred method of communication would have been nice, right? The states have a certain way of going through this every time, right? In the past, they go through it, but they're partnering, CMS has said you're able to partner with managed care plans on data sharing. The question is, how far does that translate into if my brother is living in a car, right? And he's not going to get the mail at the address that he put down, his last known address, because he doesn't live there anymore. He's living in his car. So he's never going to the address is never going to be right for Charlie. But I'll tell you what, he answers his texts for some weird reason.
Yep.
Not always great, but he answers them. And that's his preferred mode of communication for Charlie. And so knowing the preferred mode of communication and what is actually an active communication strategy for everybody, that the last panel spoke of a customer experience. Hard mailing a 13-page application to somebody, rarely the best answer. Is it electronic? Is it an email? Is it a text? Is it that sort of data, which is customer experience?
Yeah.
That's what has to have already been in place now for 80 million people to go through redeterminations. Now, not all of them have to go through. I get it. There's some automatics, but it's massive. Yeah. And we don't even know how to connect with all those folks. We should. Somebody does. Somebody knows.
Yeah.
Right?
So, yeah, can that text be a link to find the folks on the ground who know how to sit down with them and get them through that process?
Their last known service point.
Yeah.
Right?
Thank you, guys. And I want to give a special thanks to Jane for being here with us and really, you shared with us some really great information and something everybody here should be aware of. So thank you to everybody but Jane.
All right, thank you.
Thank you.
Thank you.